partial knee replacement is when just one portion of the knee joint is replaced. We think of the knee as three separate compartments, and in a lot of cases there's arthritis in more than one compartment, and in those cases a total knee replacement is indicated. But in certain patients the arthritis predominantly affects only one portion of the joint, and in those patients a partial knee replacement may be an option. The benefits of partial knee replacement over total knee replacement are that it's a smaller surgery. This tends to make the early recovery easier than a total knee replacement. And then long term, since we're only replacing one portion of the joint and the remainder of the joint remains the patient's own anatomy, it tends to feel more like a normal knee. And this can be very beneficial for certain patient populations. So our partial knee replacements always go home the same day from surgery. In general, the protocol after partial knee replacement is very similar to total knee replacement, with patients working with physical therapy for an average of 6 weeks. However, it tends to be easier for patients to get their range of motion and strength back, and in general is an easier recovery than a total knee replacement.